The Congress finally got something right. The President signed the Veterans Access, Choice, and Accountability Act of 2014 into law Thursday. I think there's three things important about this bill. Number one, it creates a $5 billion account to hire more doctors and nurses. So there's more capacity coming for veterans who need health care at the VA clinics and at the hospitals. Secondly, it allows veterans choices they don't have today. If you live over 40 miles from a VA hospital or clinic, you're eligible for a choice card. So you can go to the doctor or the hospital in your own backyard and not have to drive all day. The idea of having to drive from Greenville to Columbia to get basic health care will not be there. The third thing it does, it allows people to be fired who should be fired. In the military, there's a lot of accountability. There's a lot of responsibility, and with the rank comes privilege, but also comes accountability. The people who falsified records, the people who've done poorly by the veteran, there will be a new system allowing them to be replaced. So I'm very pleased that this happened. This bill shows some respect for the veterans who've earned our respect. And what brought this about, as always, is some crisis. Veterans were dying, waiting in line for basic health care, and that woke the Congress up. VA centers all throughout the country were performing poorly. They were falsifying records, and in a bipartisan fashion, we came together, and I think we're going to improve the quality of the veteran's life. The way you recruit and retain in the National Guard on the active duty side is you convince young people that the military is a place to go, because once you serve your country, you'll be taken care of. This bill is a giant step toward honoring that promise. This bill is a giant step in terms of reforming the VA system. For the first time since I've been involved in the military for 32 years, a veteran will have a choice to go to a local hospital, local doctor, if they have to wait too long, over 30 days, or if they live too far away. $5 billion to hire more doctors and nurses, which means better care at VA facilities, and some accountability that has never been had before. When you deal with the bureaucracy, it's like fighting kudzu. It's very hard. So this will be implemented in the next 6 months. The bill is law, but you got to get the regulations up and running. And hopefully in the next 6 months, these choice cards will be available to veterans all over the country. And we'll start hiring more doctors and nurses to make sure our veterans are better taken care of. We're a unique state. We have the best National Guard in the country, if I say so myself. We have the most veterans per capita of any state in the nation. A big, rich tradition here in South Carolina. What makes us unique is that we elect the Adjutant General, the head of the National Guard. We're lucky in South Carolina to have Major General Livingston, who has commanded troops in combat. He is the state adjutant general, and he is one of the strongest voices anywhere in the country for the Guard and Reserve and our men and women who wear the uniform. South Carolina is indeed lucky to have the leadership of Major General Livingston. He comes to my office about once a month to talk about what we can and should be doing to fix sequestration. But I met him in Afghanistan. I've seen him on the battlefield, and I'm glad to tell you, without any hesitation, he's one of the finest military leaders I've ever met, active duty, Guard, or Reserve.
Senator, thank you so much, and it is a great pleasure to occupy the stage with Senator Graham because of the great work that he and the rest of our congressional delegation from South Carolina do to enforce our military, or to reinforce our military, and to make sure that our country is properly defended. And properly defending our country means taking care of those who sacrifice so much, those special people, those soldiers, sailors, Marines, airmen, Coast Guardmen, those people that take care of our nation's defense. And this bill, Senator, I know you had a very large role in formulating this bill. It does recognize the special nature of our people. And really, it reinforces the VA system, because the majority of the people in the VA system are doing a great job. They're working hard, And it's that bureaucratic front end that kills us, and the overworking that kills us, and a couple of bad eggs. And y'all fix that. And I just thank you for doing that. Thank you for recognizing the great contributions of our men and women. And we do truly have the best military in the world. And it's because of the people of the military, but also that connection to our community and to our legislature.
Right.
And you made that happen, Senator. So thank you so much.
Well, I think it's one of the few bills that's passed in such bipartisan fashion, overwhelming vote in the House and the Senate. And again, just quick summary. More capacity, $5 billion to hire more doctors and nurses for the VA, more choice. If you live over 40 miles from a VA clinic, you can go to the hospital or doctor in your own backyard. If you wait over 30 days, you're now eligible to get a choice card where you can go out to the private sector and get health care, more accountability, easier to fire people who let the veteran down. He's going to have a challenge. He's the right guy. He's a West Point graduate. He's one of the giants of industry, so he brings a business person's background to the problem, and he's associated with the military because he's worn the uniform. I have high hopes for Mr. McDonald. I think he'll be a very good VA director. But his challenge is going to be to ride herd on the bureaucracy. This guy, as a major general, has to always reinforce the message of the day, whatever it is. So we've got to implement this law. This is a great solution on paper, but it is on paper. There is not one choice card being issued. So how quickly can he get these choice cards issued to people that live over 40 miles away and have been waiting over 30 days? The $5 billion to hire new doctors and nurses, how quickly can he tap into the medical workforce and get people to sign up for the VA? And will he use the power to fire people? My test of the new VA director is, will he clean house? Will he go to these hospitals like Phoenix and others where people cook the books and veterans died waiting and fire somebody? If nobody gets fired, we're going to be right back here again dealing with this problem. Money won't fix this problem. It can help. We need a new change in attitude at the VA, and I have confidence this guy will bring that attitude to the table. The question is he going to be determined to fight the bureaucracy that will fight back? And 6 months from now, I hope to come back here and give you an update on how well this bill worked or if it failed. Today is the first step on what I think is a long journey. On paper, we've brought about a good solution, but it's not reality until somebody implements it. I believe he's capable of doing it. But 6 months from now, I will come back, if I'm reelected, and talk to you about the progress we've made or failed to make. And if he doesn't deliver, we'll fire him. Thank y'all.